see this also, also often. And oftentimes patients would come into us and they're bothered by the dark spots more than the underlying acne or whatever caused the PIH. And of course we have to emphasize to them that we need to treat them simultaneously to get better results. Okay, so as we know, and I refer to this as PIH, it's hyperpigmentation caused by any prior inflammation of the skin, oftentimes cause acne, eczema, etc. Most common in darker skin types. In a lot of studies, you would find that pigmentary disorders present about the second or third most commonly presented thing that we see in our practice in skin of color. And we know that it's caused usually by one of two mechanisms that result in either epidermal, and oftentimes a mixed picture, and dermal melanosis. So the laser is ideally poised, and the Aerolase laser in particular, to get at that deeper pigment. So oftentimes we have our patients, and we may start them on topical treatments, but you get so far. And as this case would demonstrate, when we add the laser, we're able to get better clearance, and it can be combined. I think, was it Wendy who mentioned, sometimes I do microdermabrasion before the laser, sometimes you can do the peel right after the laser, a gentle peel. And we know that PIH can cause tremendous embarrassment for the patient. Oftentimes part of my job is being like almost a psychologist, because you have to deal with that aspect when they can't even look you in the eye. And to be able to treat this, we have to recognize that it is a big deal to patients and not brush it aside as something that's trivial, And there's nothing better than having patients who say, "Doc, I can go without makeup, this is great, this is the best thing since sliced bread." Okay, so as we know, it's a combination approach. As in everything we do, combination, combination, combination. So we have to focus on treating the underlying inflammation, reducing risk factors. Remember, patients are not just using what we give them. Oftentimes they go to the pharmacy, they want to pick up that scrub, that mask. We need to emphasize with the patients, don't do too much. And patients can get very desperate, so less is more oftentimes when we're treating this, because as we know, irritation leads to hyperpigmentation. So of course, sunscreens and sun protection, that's a whole topic in and of itself. We have to emphasize that this is an ongoing care, like a lot of other things, similar to melasma, because you find that patients, they may repigment after you stop everything. So they have to think that I have to have a long-term approach to managing this problem. And of course, skin lightening agents. Hydroquinone I still find as the gold standard in combination preparations, like modified pigments preparations. And then, of course, your non-hydroquinone agents when you're giving them that break. Very important. And so we have other procedures. We know microderm, chemical peels, dermal microneedling. And as I said, lasers are well positioned to take us deeper. And what is so cool about the Aerolase laser is that it's so much safer. I have received treatments with both traditional lasers and the Aerolase laser, and the pain factor is so much less, it's much safer. I'm really pleased with it. And of course, we have to pay attention to the psychological support that these patients may need. All right, so as has been said before, we know that this laser can remove both dermal and epidermal melanosis in patients of all skin types in combination with a chemical peel or hydroquinone. And we know that it penetrates deeper, and by the mechanism of action is safer than traditional lasers. And so the objective of the case report was to demonstrate the efficacy, safety in treating these conditions in combination, like we do all the time, with a chemical peel and medical treatment. Okay, so this patient, a young lady, she had been dealing with acne for a long time, and she had gotten so far with just medical treatment alone. So she was on tretinoin, 0.05%, a combination of 4% hydroquinone, 1% hydrocortisone, and ascorbic acid on alternate nights, and 5% benzoyl peroxide with 1% clindamycin gel in the day. And then, she got so far. But then when we introduced the laser treatment, she had about 2 laser treatments, one at 6 millimeters at 21 setting, and then the second one at those settings. And what I often do is when I when you're doing a procedure, I often would test them at the end of that procedure so that when they come back the next time, you already can determine if you're going to go higher the next time. And so she was actually able to tolerate 2 millimeters at your power setting 2, which is a fluence of 64. So immediately after the last laser treatment, a combination chemical peel with salicylic acid, lactic, citric, kojic, and hydroquinone was performed. This is the Miami peel, which I find very safe, very useful in combination with the Aerolase Neo. Her topical medications were usually discontinued about 3 days before the procedure at least. Of course, some patients, we say a week, but I find with the Aerolase Neo, it's fine at least 3 days prior to stop their medications, topicals. And then resumed about 5 days after. Of course, this is individually, this can vary. Results were assessed with clinical photos and also by the patient. 2 weeks after the last laser and chemical peel, she noted significant lightening of the PIH with complete visible clearance 6 weeks after. And she was very happy with her results, which were maintained when examined 9 months post-treatment. All right, so this is her before and after. So, yeah. So, as we can all attest to, the Aerolase laser can safely treat these conditions and in combination quite safely.